webinar event, Policy versus Pandemics, Polarization and Public Health Emergency Preparedness, featuring Professor Nathan Myers from Indiana State University. My name is Gregory Koblenz, and I'm the director of the Biodefense Graduate Program at the Schar School of Policy and Government at George Mason University. Dr. Myers and I started planning this event for him to talk about his new book, Pandemics and Polarization, back in December. Originally, he was going to give this talk at our campus in Arlington, Virginia. But as the coronavirus spread throughout the United States, we decided several weeks ago to convert the event into a webinar. The webinar will be recorded and posted on YouTube channels sponsored by Indiana State and the Schar School. So those of you who are registered for the event will receive an email once the videos are uploaded with a link to those sites that you can watch later or share with your friends and colleagues. Dr. Nathan Myers is an associate professor of political science and public administration at Indiana State University, where he studies public health policy, emergency preparedness and response, and the regulation of biotechnology. He's also the associate dean or associate director of the Center for Genomic Advocacy at ISU and serves on the advisory board of the West Central Indiana Area Health Education Center. Most importantly, for our purposes today, he's the author of Pandemics and Polarization, Implications of Partisan Budgeting for Responding to Public Health Emergencies, which was published late last year. I got a sneak peek at his book before it was published, and here's what I wrote about it at the time. Pandemics and Polarization is a valuable contribution to literature on public health emergency preparedness. The book documents how the growing virulence of politics in the United States has converged with the increasing risk posed by emerging infectious diseases. Dr. Myers rightly places politics front and center in his analysis of U.S. responses to public health emergencies such as H1N1, Ebola, and Zika. This book is an important wake-up call to the public health community about the degree to which responding to public health emergencies has been politicized. Neither partisanship nor pathogens can be eradicated. The public health community needs to understand and be better prepared to deal with outbreaks of both. Likewise, politicians need to better understand the importance of investing in public health to mitigate the impact of future pandemics. Unfortunately, we have seen the impact of partisanship and political polarization on public health and pandemic response demonstrated all too vividly and visibly over the last several months. I highly recommend Dr. Myers' book to anyone interested in politics, public health, and pandemics, which at this point is probably everyone in the world. And for those of you who've registered for the webinar, you'll be receiving an email with a discount flyer good for 3% off of the book in the next day or two. So I very much look forward to hearing Dr. Myers' presentation. At the end of his talk, he will be able to take questions until about 7:30. Once his presentation is over, you can use the raise hand feature on Blackboard at the bottom of your screen in order to get in the queue to ask questions. So with that, I will turn the show over to Dr. Myers. Thank you very much.
All right, thank you very much, Dr. Koblenz, for that great introduction. In fact, you saved me from having to go through a lot of introductory material myself, so I'll just say to start off, thank you to the Schar School of Policy and Government at George Mason University for their invitation to do this and their flexibility in making it a webcast when the opportunity to do it as an in-person presentation was no longer an option. And of course, thank you to Indiana State University, the College of Arts and Sciences, and the Department of Political Science for giving me the freedom to do the book and also giving me the resources to do this webinar this evening. Before we get started, I do want to acknowledge that I'm giving this talk in the midst of a very sad and difficult time for our nation and the world. Checking the Johns Hopkins University website, the number of deaths worldwide is a little over 523,000 at this point, or I'm sorry, 526,000 rather. And I just saw on CNN that the U.S. has crossed the threshold of 1,000 deaths. So I want to just have a brief moment of silence in recognition of the people who have passed away and the healthcare providers and other people around the world who are trying to manage this situation and save as many lives as they can. Thank you. So I'm going to be doing a little bit of moving back and forth. So excuse the fact that this isn't necessarily seamless, but given the technology, it seems like the most efficient way to do it. So many of you probably recognize this. Many of you have probably played the board game Pandemic at some point. And no doubt, I don't think any of us will ever play this game or look at this game in the same way again. But the reason why I present this as my first image is because I want to tell you a little story to begin my presentation. So last semester, I was working with a graduate student in the Master of Public Administration program, Jason Collins, and an undergraduate student in our political science department, Gage Atwood. And we were working on developing a simulation that we could use in a classroom setting to teach about the relationship between pandemic preparedness and public administration, public policy, political science. And we developed this simulation, and we were running through the simulation. And one time when we were running through the simulation, Jason and Gage, who were working together as a team, ran into a situation where the city of Chicago had too many patients. The number of patients was represented by cubes, as they're represented in the pandemic board game. They had too many cubes in the city, and in order to prevent Chicago from being overloaded, they had to move 2 cubes out of the city to another city. And they technically had the ability to do that because the game said that if you had a resource card, you could trade in that resource card and move 2 cubes from your city to another city. The problem that they ran into was that the other cities were already on the brink as well. So if they moved those 2 cubes to another city that would be an option, that city would be overloaded and the game would be lost anyway. The system would be overloaded. But after some deliberation, they came to a solution to this problem. And I'll talk more about the solution that they came to at the end of the presentation, as that kind of ties into the final message, as it were. So Dr. Koblenz gave me a good roadmap, I think, in terms of how to go about doing the presentation when we developed the title together, Policy versus Pandemics, Polarization and Public Health Emergency Preparedness. So effectively what I'm going to do is I'm going to go through each of those topics in turn and then kind of talk about how, based on the material that I gathered from my book and based on my observations from what is currently going on today, all of that information kind of ties together. So in my undergraduate public policy course, we start off with defining what policy is. I'm sorry, is there, oh, okay. Yes, very good, thank you very much. And definitely keep in mind that we'll have opportunity for questions and comments later on in the presentation. So if you have any questions and comments, we can deal with that in the last approximately half hour or so. In terms of defining public policy, the definition that I typically use is what government chooses to do and chooses not to do in the public's interest. And that's obviously, a very broad definition and leaves a lot to the imagination. But the thing that I like about the definition is that it addresses what government chooses to do and also what government chooses not to do. Because that's very much the situation that we're in right now in terms of things like travel restrictions. Do we choose to implement travel restrictions or do we choose not to implement? travel restrictions. And we're not just talking about international travel restrictions, we're talking about domestic travel restrictions. So we're very much in this kind of interesting gray area from a policy perspective, and a difficult situation as a country in terms of how to move forward. So something else that I talk about with the students are the different forms that policy can take, and the different institutions in government that implement policy. So you see there an image of a cruise line, and again, many of us will probably never look at a cruise ship the same way again, based on the situations that have emerged with the quarantining of people on cruise ships and so forth. But a few years ago, when I had to go through examples of forms of policy making in the different institutions that make policy, I used quarantine policy as an example, and at the time, the students, I think, thought it was kind of an odd example or kind of off the wall, but now the relevance seems a little more clear. So obviously, you have the President of the United States who establishes the list of diseases for which people can be quarantined. You have the Congress that first codified the federal government's ability to place people under quarantine in 1944 when they passed the Public Health Act. You have the courts that have adjudicated numerous cases having to deal with when government can and can't quarantine individuals in the midst of an outbreak. You have the administrative agencies, particularly the Centers for Disease Control and Prevention, with the director of the CDC having some pretty wide purview in terms of deciding if an individual needs to be placed into quarantine. And of course, you have the state and local governments, particularly the state government, with the power to quarantine, as states have the primary police power over public health in the country. Which brings us to the next topic that I usually cover with the undergraduate students, which is the concept of federalism. And federalism, as I'm sure many of you have talked about in classes or perhaps even teaching this subject matter, federalism can be a double-edged sword in that it's often looked at as a strength of our nation because as a nation, we don't really like the idea of centralized governance or too much control in the central government. But also it's a strength in that we have this concept of the laboratories of democracy. So we have different states can take different policy approaches to dealing with a problem, and then we can kind of take the lessons learned from states' experiences and apply them to other states. So oftentimes, that's how it works, and no doubt when this has passed and we have time to actually research what's transpired over the course of the COVID-19 pandemic emergency, we'll look at the different responses that the states have had and evaluate, which responses were more effective than others and things like that. But what many people are finding problematic at this current point in time is the fact that there's so much difference between the states in terms of the approaches that have been taken. Just by looking at these four maps from Politico, you can see there's a lot of diversity among the states in the country in terms of banning large gatherings, instituting mandatory quarantine, non-essential business closures, and paid sick leave. So these policies are diffusing in a very patchwork kind of way. And a lot of public health experts and researchers believe that this is at the US's detriment, because when you have this kind of patchwork, it's going to make the flattening of the curve more difficult, which could actually prolong how long this lasts, how long this remains a severe problem for the United States. So something else that we talk about in my classes are policy values by which we evaluate whether policies are effective or not, whether policies are, for lack of a better term, good or bad. One of those policy values is effectiveness. Does the policy actually work? And I alluded to the travel ban or the travel restriction issue earlier. That's one of those issues that we continue to debate among ourselves. Public health experts debate it, political scientists debate it, government officials debate it. Obviously, in the case of the Ebola emergency, there were a lot of people who argued that travel restrictions were only going to harm the response because it was only going to make it more difficult to get resources and personnel to help the countries where that assistance was needed, and it wasn't going to do that much to protect the country. Now, fast forward to 2020, and we have travel restrictions on China, travel restrictions on Europe, and there are some people who are arguing that those travel restrictions were actually merited, not because they ended the threat to the United States. Obviously, they didn't. But there's the argument that they slowed the transmission to the United States. They bought us some time to work with. So another issue is efficiency. Are we accomplishing the goal that we're setting out to accomplish using the least amount of resources possible? So, looking at that from an economic perspective, there's been a lot of discussion, obviously, about stimulus spending and how we can stimulate the economy and do things for low-wage workers to allow them to get through this without going hungry and losing their homes and things like that. How do we make sure small businesses and large businesses stay in business? And a lot of things have been suggested. At one point, they were talking about doing a payroll tax cut. But a lot of people argued that the payroll tax cut would not be an efficient approach because a lot of people, as we've seen with the unemployment numbers that have come out today, a lot of people are being put out of work by this situation. So if you're not receiving a paycheck, a payroll tax cut is not going to help you. So in terms of things that the U.S. government could do to ameliorate this situation, the payroll tax cut doesn't really seem like a logical one. Equity, our policies treating people with fairness, and there's a lot of ways that the issue of equity factors into what's going on right now with the COVID-ID or the COVID-19 pandemic. First of all, equity in terms of the government providing financial support for low-wage workers, the middle class, and balancing that with support for corporations and other larger types of entities. So there's equity in that respect. There's also the much more solemn kind of equity when it comes to the use of ventilators and medical equipment, which we obviously, if you've been watching the news, have a shortage of those items in this country. And that's an issue that was debated, back in 2009, 2010, when we had H1N1, and there was a lot of concern that we would have a shortage then. So people for a long time have been talking about the ethical implications of that, and we're having to confront those again today. And then another issue with equity is avoiding stigmatizing people, avoiding discrimination, not singling out Chinese people, Chinese Americans, or any people of Asian descent in the United States or any place else in the world and singling them out for blame. We have to approach this problem as one people and recognize that the blame for the virus shouldn't fall on any particular race or ethnicity. Liberty and security are obviously very closely bound together. Liberty I often articulate as liberty is our ability to go out and pursue life and the pursuit of happiness, to go out and to live our best life. And so we want as few restrictions from government. We want as few restraints from the market as possible in order to do that. But in a situation like this, when you're looking at it from a security perspective, a lot of us are giving up our liberty. We're giving up our freedom of association, giving up our freedom of movement, our freedom to go to work and earn a living for many people. So in the name of security, the U.S. government and state governments are asking the people to do a lot. And it's with this intention and this explanation that by doing this, we're saving people's lives and we're preventing the healthcare system from collapsing or becoming overly strained throughout the United States. And then finally, the issue of resilience. Creating policies, effecting policies that make us stronger as a country and will keep us stronger in the long term. So, one of the questions that is sort of blooming out there recently is, how is the 2020 general election going to move forward in light of everything that's going on? Are we going to be able to hold the elections in November as we typically do, or are we going to have to shift to some other form of voting? Some people are concerned about the possibility of it being delayed. And we have to think very carefully about the options that we undertake in that regard, because choosing the wrong options could ultimately make us weaker as a country, because if we erode people's confidence in democracy and faith in the electoral system, that could have repercussions that last for decades potentially. And also, along the same lines, Congress being able to function in times like these, being able to cast votes and being able to deliberate without actually being together in the same chamber. So in the long term, recognizing that something like this could happen again and building up policies that allow Congress to continue continuity of operations without everyone being physically present in the chamber. So in terms of COVID-19 and dealing with the pandemic aspect of it, my book deals with three primary themes when it comes to public health emergency preparedness and response: surveillance, coordination, and countermeasures. So I'm also going to use those themes tonight in the discussion of the pandemic situation that we're currently confronting. So in terms of surveillance, there were some notable successes early on, particularly with the sequencing of the genome of the COVID-19 virus. That gene was sequenced very quickly, and it was shared with scientists around the world, permitting the research necessary to develop vaccines and antivirals to get started very quickly. Obviously, we've had a lot of challenges in the surveillance realm since then, and the debate over testing has been going on all over the place in Congress and the media, but obviously a lot could have been done better in terms of getting a test to healthcare providers and public health departments and getting started with testing earlier. To share with you so this is a table that I found from the website Our World in Data. So you can see this is data as of March 17th, 2020. So obviously not the most up-to-date information, but I still think it's fairly representative of the difference among the different countries in terms of the amount of tests performed per million population. So we can see that as of March 17th, the U.S. was behind, and the U.S. continues to be behind countries like South Korea, which has been singled out in a lot of quarters as a country that has done a pretty effective job in terms of getting getting the tests out and aggressively testing and mitigating the virus that way. So in terms of the testing issue, there's been discussion about when a vaccine would be available. There, some projections from politicians have been sooner. People in the public health field or people who do research in the medical field have pointed to the fact that we're likely in for a considerable wait. So I want to play just a brief video. This is Dr. Anthony Fauci, who I think most Americans have become very familiar with him as a preeminent expert on these issues, and he's been around a long time. He dealt with HIV/AIDS, he dealt with H1N1, he dealt with Ebola, Zika, and now he's managing the current response. Oh, I apologize for the lack of audio with that. So in terms of addressing the countermeasure issue, obviously the message that public health personnel are trying to get out there is that it is going to be a while until we get a vaccine or even another form of countermeasure that we can count on to safely and effectively deal with COVID-19. So in the meantime, we do need to institute social distancing practices and do what we can do as a community and as individuals and as citizens of the nation to mitigate this situation. So in terms of coordination, there's a number of issues that are in play when it comes to the coordination issue. So in terms of coordination, there is obviously coordination between federal, state, and local officials, but there's also coordination between governments and the private and the nonprofit sector, particularly the medical sector, and there's coordination between public health and hospitals. So just to look at a few examples of this from the media. So a recent article from The Hill by Dr. Bonnie Stabile of George Mason did a really good job of talking about the issue of coordination among hospitals. And the issue here is hospitals not coordinating on issues like canceling elective surgeries. The argument is that hospital systems and different institutions should sort of come together, that the American Hospital Association and other groups should lay out some clearer guidance as to hospitals canceling elective procedures. And obviously this is a significant issue with hospitals because hospitals make a lot of their money through the use of elective procedures, but obviously elective procedures use up personal protective equipment. They're potentially putting medical personnel at risk of contracting the virus from the people who are coming in for those procedures. So in her view, there needs to be more coordination and cooperation in terms of limiting the use of those kinds of procedures. In terms of the federal government and the state governments working together or not working together, an issue that's been preeminent in the media recently is the desperate work by state governors to get a hold of more masks, more ventilators, more gloves, things of that nature. And the fact that the federal government is not really centralizing those efforts to any significant degree. In fact, the federal government is out there bidding on those materials, and the state governments are individually bidding on those same kinds of materials. So effectively, you have the federal government competing with the states and the states competing with each other, and that's not really helping the situation with getting materials to where they're needed most. Ideally, the federal government would be playing more of a role, making sure that materials go where they're needed. And then finally, the issue of domestic travel. A few years ago, in 2018, the Center for Health Security at Johns Hopkins University did an exercise called CLADE-X, and one of the scenarios in that exercise was that a governor of a U.S. state tried to restrict domestic travel to that state in the midst of a biological attack. And I thought at the time that seemed kind of an extreme scenario, but now we have that playing out in real life. So we have, the governor of Florida that in some ways is not doing everything possible to restrict the spread of the virus within his own state, but is concerned about people coming from New York and New Jersey and places like that and bringing the virus in. So rather than coordinating with other state governors, going directly to the Trump administration and arguing, we need to shut down domestic travel in the country. So if we had, more coordination between the White House, the federal agencies, and the states in terms of managing the situation, if we had more uniformity in state policies, this kind of situation could hopefully be addressed in a little bit more effective manner. So the issue of polarization is obviously a prominent topic in my book. Pandemics and Polarization dealt with the polarization in the response to the Zika emergency back in 2016, and now we have some similar kinds of themes playing out today. So Dr. Koblenz shared a tweet with me, which I'll show you in a little while, between President Trump and Senator Chuck Schumer, where they were going back and forth in some very kind of vitriolic terms, criticizing each other's job performance and intelligence and other things, which, you know, is, I think most people would argue, is not helpful in a crisis when you have two leaders of government who are both important to handling a crisis, fighting it out on Twitter and kind of making it a partisan food fight as opposed to a legitimate policy discussion. Another thing that's notable to me in terms of the partisanship and polarization aspect is the reaction to the appointment of an Ebola czar during the Obama administration, as opposed to the appointment of the COVID-19 czar in the Trump administration. So in 2014, 2015, we had the Ebola situation. There was a concern that the US government response wasn't coordinated enough, so the Obama administration brought in Ron Klain to serve as an Ebola czar, and he was criticized by many people, including Donald Trump, because he wasn't an infectious disease specialist. He was not a healthcare professional or public health expert. He was criticized as being a political hack. Now, fast forward to 2020, and Vice President Pence is put in charge of the coronavirus task force by President Trump, and he is criticized not only because he's not a public health expert, but because as governor, he was seen as not being particularly effective in stopping an HIV outbreak in Scott County in Indiana in a timely manner. So you can look at the Ebola czar situation and the COVID-19 task force situation and see some echoes of polarization there. Now, obviously, you know, we've had some good bipartisan effort when it comes to the passage, particularly of the first two stimulus bills that were passed, and obviously the White House and the Senate have come to agreement on the $2 trillion package that still has to pass through the House of Representatives. But there was a lot of partisan wrangling that went into that agreement between the White House and the Senate, a lot of that revolving around Democratic demands for oversight over corporations, making sure that large corporations, if they get some money from this $500 million part of the fund, how are we going to ensure that money is used appropriately? And the Democrats were effective in getting the White House to agree to an oversight mechanism, having an oversight board over that, and also effective in holding out for making sure that lower income Americans are taken care of, more assistance goes to hospitals and things like that. But we still have, some of the same partisan battle lines that we saw during the Great Recession in terms of that response, and we've seen in some other national emergencies since then. So I'm going to go ahead. I want to show you just a few documents here. So I'll show the tweet that Dr. Koblenz shared with me, because that seems to kind of sum up where some of the rhetoric is today. President Trump, crying Chuck Schumer is complaining for publicity purposes only that I should be asking for more money than $2.5 billion to prepare for coronavirus. If I asked for more, he would say it is too much. He didn't like my early travel closings. I was right. He is incompetent. And then Chuck Schumer's response, I didn't just criticize President Trump's pathetic, inadequate funding request. I noted his incompetence, how he has no plan to deal with coronavirus. And then it goes on to talk about the dismantling of the NSC's global health security team and cutting funding to the CDC as well. So that's one example of sort of partisanship on display. And then obviously the tweet from then citizen Donald Trump. Obama just appointed an Ebola czar with zero experience in the medical area and zero experience in infectious disease control. A total joke. So Donald Trump, not surprisingly, was very critical of a lot of aspects of the Obama administration's response to Ebola. He thought stronger travel restrictions should have been put in place during that situation as well. So I'll also share this. This is in relation to Governor or Vice President Pence being criticized for being put in charge of the COVID-19 task force based on his prior experience as governor. The first quote from David Cicilline, a Democrat from Rhode Island. There was an outbreak of HIV in Indiana a few years ago because Governor Mike Pence was horrible on public health policy. So no, I'm not relieved that Trump has him leading the coronavirus effort. Then you have Speaker Pelosi. I spoke with the Vice President this morning, made some of these concerns known to him. We've always had a very candid relationship, and I expressed to him the concern that I had of his being in this position. And certainly, it's perfectly valid to look at somebody's past record in evaluating whether or not they should be in a position like that. It's just interesting. What's interesting to me is the fact that based on President Trump's past criticism of Ron Klain as Ebola czar, he just didn't keep Secretary Azar in the position or put Dr. Fauci into the position. He still put a politician into that position, knowing that he was going to get this type of criticism. So it's important to note at this point that there is a long history of bipartisan effort to prepare the United States or try to prepare the United States for a pandemic. Democrats and Republicans collaborated on the development and passage of the Pandemic and All Hazards Preparedness Act, which has been updated a number of times since its original passage in, I believe, 2006. That's one piece of legislation that has made a big difference for preparedness in terms of the hospital preparedness program and the public health emergency program. There's also been bipartisan support on protecting the budgets of the CDC and the National Institutes of Health from budget cuts and actually raising those budgets over time. For example, Representative Tom Cole, a Republican from Oklahoma, has been an outspoken advocate for increasing the budget for the National Institutes of Health because he believes that doing so ultimately results in great gains for the country. The research that is done by the National Institutes of Health translates into a lot of great information and technology that can be used to build up the public health. And I'll share a couple of other examples here. So in terms of the Public Health Emergency Preparedness Fund, so the Public Health Emergency Preparedness Fund has been an issue that's been discussed significantly since at least the Zika emergency is when I first became aware of this idea that we need a standing Public Health Emergency Preparedness Fund, similar to the fund that the Federal Emergency Management Agency has for dealing with tornadoes and hurricanes and weather-related disasters such as those. So during the Zika emergency, you had people, Ron Klain, Tom Daschle, and people in Congress and other types of policymakers talking about how we need this permanent fund, because whenever we have one of these public health emergencies, we shouldn't have to wait for a supplemental appropriation from Congress. It should just be a situation where the federal agencies should be able to draw from this fund and immediately go into action. Well, back in February, U.S. Senators Marco Rubio, obviously Republican from Florida, and another Republican Senator, Bill Cassidy from Louisiana, joined forces with Brian Schatz, Dick Durbin, Tina Smith, all Democrats, as well as Angus King, an independent from Maine who regularly caucuses with the Democrats. And they introduced a bill to institute this kind of permanent fund, continuing to recognize that we're going to deal with these public health emergencies on a regular basis. They may not all be on the scale of COVID-19, and hopefully they won't be, but they are going to continue to emerge, and the faster we can get action, the better. And if that means not requiring Congress to vote on every single dollar that goes toward that kind of response, then that's a good option. So that's one example of sort of current bipartisanship. And another example that I wanted to point to was the Advancing Emergency Preparedness Through One Health Act of 2019. And effectively, this bill would create a permanent interagency working group consisting of Health and Human Services, the Environmental Protection Agency, the Department of Agriculture, and a variety of other federal departments to look at preparedness from the One Health perspective, recognizing that the threats that we're going to face in the future in terms of public health, they're not just going to be about human health or animal health or the difference in the climate. It's going to be all of these things interconnected. So we need to have an interagency working group that's actually going to look at these connections and figure out policy that can actually address these issues in an interconnected way. So given all of the differences of opinion that Republicans and Democrats have on the issue, particularly when it comes to climate change, I'm heartened by the fact that this One Health approach does have some bipartisan support. You look down, from my own state of Indiana, Senator Todd Young is a sponsor. Chuck Grassley, Republican from Iowa, is a sponsor. And then you have Tina Smith, again, from Minnesota, a Democrat. And then Dianne Feinstein and Kirsten Gillibrand, who are obviously Democrats as well. So you have some bipartisan consensus, at least growing around these kinds of topics. So in terms of public health emergency preparedness, kind of building off of this theme of bipartisanship, I'm going to talk a little bit about the National Biodefense Strategy. So the National Biodefense Strategy, as it exists today, started out originally as a bill, the National Biodefense Strategy Act of 2016, that was sponsored by Senator Ron Johnson, a Republican of Wisconsin, and co-sponsored by Joni Ernst, a Republican from Iowa. And it wasn't passed into law as its own standalone bill, but it was incorporated into the National Defense Authorization Act of 2017, which was passed by a significantly bipartisan margin. It passed the House 375 to 34 and the Senate by a vote of 92 to 7. And obviously, the National Defense Authorization Act wasn't passed on a bipartisan vote because of the biodefense strategy portion of it. There's a lot of reasons for both Republicans and Democrats to support the military in their districts and in their states. But it shows that it passed as part of a bipartisan vote. And I want to look at some particular elements of that that deal with the themes of surveillance, coordination, and countermeasures. So this is one part from the National Biodefense Strategy that deals with ensuring that domestic and international biosurveillance and information sharing systems are coordinated and are capable of timely bioincident prevention, detection, assessment, response, and recovery. And subsections talk about enhancing the integration and evaluation of biosurveillance systems, improving information sharing and reporting, and developing and deploying enhanced biosurveillance and bioincident characterization capabilities. So all of these kinds of systems obviously would have been very valuable if they had been fully implemented in the early stage of the pandemic, when we were first made aware of what was going on in China. And if we could ramp these things up now, that would be very helpful in terms of managing the current crisis and making more informed decisions. In terms of countermeasures, an important thing in the countermeasures section is improving diagnostic capabilities. So again, if we had had a diagnostic for COVID-19 that was ready to go from the beginning and could have done the sort of aggressive testing that was done in other countries, we potentially could be in a much better situation today. So that is folded in as part of the countermeasure part of the strategy. And then another part looks at medical countermeasures development, sustainment, and availability. So obviously, the current situation has highlighted the fact that with all of the increases in technology, improvements in technology involving genetics and genomics and biochemistry and so forth, we still have a significant amount of difficulty getting vaccines and other types of countermeasures to the public in a timely manner. So finding ways to leverage this new technology that we have and the technology that is evolving all the time to prepare for the next emergency. And then finally, in terms of coordination, conduct federal response operations and activities in coordination with relevant non-federal actors to contain, control, and to rapidly mitigate impacts of biothreats or bioincidents. And this involves things like ensuring appropriate oversight and coordination. So that was, part of the issue with the stimulus bill as it was being debated in the Senate, and the talks between the White House and the Senate was, you need oversight, and there also needs to be oversight over, the way that resources are distributed to the states and the localities and so forth. And that kind of comes into play with the other subsection, deploying countermeasures and implementing community mitigation measures. And that issue of community mitigation measures, we're all a part of that now. We're all engaging in social distancing. We're all, sort of keeping to ourselves as much as our lives will allow us, in hopes that flattens the curve and mitigates the long-term effect of this crisis. So we need better coordination of that, better guidance from the federal level, better coordination of the states to sort of maximize that effectiveness. So to review, we just covered the biodefense, National Biodefense Strategy, which is kind of an outline of the things that the federal government needs to do or needs to be doing on a regular basis in order to be prepared for an emergency like this in the future. We discussed polarization and how the polarization that has occurred in the past and the polarization we see on display now can be detrimental to the response. But we've also seen the evidence of bipartisanship as well. And then obviously, to face pandemics, we need surveillance, coordination, and countermeasures. And the only way to effectively implement those activities is to have effective policy. So I want to wrap up by kind of going to the beginning. So first of all, I started off with the anecdote about my students and the research that they did developing the simulation. And they were in that situation where they had 2 cubes worth of patients more than the city could handle, and they needed to transfer it in order to prevent the city from being overwhelmed. But they couldn't send it to either of the 2 cities that were a possibility, because then those cities would be overwhelmed. They would be counterproductive. So Jason and Gage, the 2 students, talked about this for a while, and then Gage sort of got a thoughtful look on his face and sort of asked, according to the rules, it says that if you have a resource card, you can move 2 cubes worth of patients out of the city. Is that right? And I said, yes. And he said, does it actually say in the rules that both of the cubes have to be transported to the same city in particular? So, I thought about it. I looked at the rules as we had written them down, and I said, you're right, actually. It doesn't say that, with that resource card, you have to transfer both cubes to the same city. Potentially, you could split them between the 2. So after deliberating about it a little more, that's ultimately what they decided to do. And that did put all 3 of those cities right at the brink, but it allowed them to carry on with the simulation. And ultimately, they finished the simulation successfully. So I raised that because it sort of is an example to me of how public health, emergency preparedness and response, and policymaking more generally are connected, in that you need to have surveillance. And in the case of policymaking, surveillance is about gathering data, gathering information about a situation to make the most effective response. And then coordination, so working with your partners to work out, okay, we have this information, we have some potential options, let's coordinate on the best approach. And then finally, countermeasures in the policymaking realm is the actual policy. You select a policy and then you work together to implement that policy. And that's what, at a very minor level, those 2 students were able to do, because they looked at the situation, they coordinated with each other, they thought outside the box, and they came up with a solution that allowed them to get out of a very difficult situation. And that is what I think, in order for this situation in the US and around the world to be resolved, we're going to need more of that. We're going to need more looking at the data, looking at the public health data and making decisions based on that, more coordination both within the United States and around the world, and actually thinking through, what policy is good for the country as a whole, or what policy is good for the world as a whole, and focusing on implementing that. So going back to the policy values discussion, I want to talk about those values very briefly again, but I want to take a little bit of personal privilege and kind of integrate some Unitarian Universalist principles into the conversation. And I think they're integrated in a way that people of other faiths and religions can appreciate. So hopefully it doesn't come off as proselytizing or anything like that. But in terms of effectiveness and efficiency, I relate that to the principle of promoting a sense of world community. So we need to think about what policies are going to be effective. Are travel restrictions going to be effective? We need to think about what policies are going to be efficient. Are certain types of tax cuts going to be efficient, or certain types of economic aid internationally going to be efficient? But we have to make those effectiveness and efficiency decisions in light of the fact that now more than ever, we are part of one world community, and we need to act in that way moving forward, not just to get through the immediate danger, but to make sure that something like this doesn't happen again. Equity involves acknowledging the inherent worth of all people, which is going to be very important. It's very important in terms of the stimulus and making sure that low-wage workers and people who are well below the poverty line are still given the means to keep themselves alive during this situation. It means making sure that any decision about rationing ventilators or any other types of medical equipment take into account the inherent worth and dignity of people. And it means that we need to avoid stigmatizing people. We need to avoid falling back on discriminatory practices. When it comes to liberty and security, acknowledging the extent of human interconnectedness. So again, as I kind of alluded to at the beginning of the talk, we're being asked to surrender kind of an unprecedented amount of our liberty right now. We're not being allowed to go to work. Kids aren't allowed to go to school. We can't socialize with our friends. We can't go to bars and restaurants in many cases. But we're doing this with the recognition that we're not only protecting ourselves, but we're protecting other people who could be much more in danger of contracting the virus, particularly the elderly, the immunocompromised, although a lot of other groups of people are being affected negatively as well. And then resilience, going back to that idea of upholding democratic values, making sure that not only that we keep the electoral system functioning and that we respect elections moving forward, but also that we are democratic in terms of continuing to give the people a voice in the deliberations as to how these measures are carried out and the choices that the government makes. The government is going to have to make a lot of hard choices. The federal government is, the state and local governments are, and some of those are sure to be unpopular. And that's not to say that public opinion should rule by any means, but the public needs to have a voice moving forward. It can't just be unitary action across the board. So in conclusion, I started with that question of what is policy, and the definition that I've used is public policy is what the government chooses to do or chooses not to do in order to advance the public's interest. But now the situation has changed, and now it's not about what policymakers are choosing to do or choosing not to do, or at least not just about that. It's about what we're choosing to do or not to do. There's a lot of discussion going on right now. When should this social distancing be lifted? When should we be allowed to go back to work? And a lot of people are making their own choices right now. A lot of people are making their own policies right now as far as to what degree they respect social distancing, to what extent they avoid public gatherings and things like that. And we need to be mindful of that, and we need to use our own best judgment moving forward about how to protect our neighbors and our friends and our family. So I started with the image of the pandemic board, and I'll end with this image, which was taken, I believe, yesterday from the Johns Hopkins University COVID-19 website that shows the kind of state of play of the virus throughout the world. And this is obviously the furthest thing from a game that you could possibly imagine. But we are all participants in this situation, and we all do have our role to play in the current circumstance. But we also, of course, have a role to play moving forward. And for my part, in teaching about public health emergency preparedness in a political science or a public administration setting, I always kind of felt like the students didn't necessarily make the connection, and they just kind of thought maybe it was something of a fringe topic in some ways. But now they're learning in stark terms why it's relevant to their lives. And moving forward as a professor, as an educator, it's incumbent upon me to not let people forget that this happened, to remind people that this happened, that it could happen again, and we need to make policy in order to try to prevent that in the future. And also using whatever voice I have to advocate for more effective preparedness policy in the future as well. So with that, that's the conclusion of my prepared remarks. So I'll be happy to take any questions. A few people have already typed into the chat room. You may be able to use your microphone as well, but if you want to use your microphone, please click on the raise hand icon so that I know you plan to do that. So, all right. Those of you who are raising your hand, I will get to you. I'm going to get to the people in the chat room first. So appreciate your patience with that. Javier Garcon says, where are we with policies that are protected from politics? It seems that politicians have too much red tape, and by the time we respond to the pandemic, it's too late to contain. I believe that the law should not allow politicians from interfering with pandemic response forces from doing their jobs. Is this all completely true in your professional opinion? Well, so the Public Health Emergency Fund that I spoke about earlier, I think is one example of Congress trying to create a policy that would allow public health responders to move forward with a response without worrying about whether or not Congress is going to provide the funding or not. With Zika, there was a significant issue with a delay in funding. And fortunately, that wasn't the issue this time around, or at least it hasn't been up to this point. So that would be one example. Obviously, there's a lot of concern right now with the degree to which politics is driving the country's response versus how much public health experts are driving the response in terms of, when we implemented social distancing, how long we're going to keep social distancing activated. And it's important for elected leaders to ultimately be the ones to make the decision because they are the elected representatives, but it's also important that those decisions be made by those decisions be informed by the best information from the experts. So the Obama administration, before they left office, tried to create within the National Security Council an infrastructure for managing a pandemic in just this kind of situation, and that was effectively disbanded by the Trump administration. I think the best thing to do after the immediate danger has passed and we start to figure out, what do we do moving forward, is to reinstitute that structure. And not that, the NSC is going to be calling the shots, but we need a structure of people who are going to come together and without political interference, make recommendations to the president and his other advisors, and make it a more streamlined kind of process in that respect. So thank you very much for your question. Do you know why the U.S. is so much behind other countries for test kits? I've heard the problem is the reagent, but no real explanation. I don't know the technical details. As I understand it, the World Health Organization had a test kit that they could provide to countries if they wanted it, and the U.S. For reasons that I still am not fully aware of, decided not to use the World Health Organization test kit. So the CDC developed a test kit, is my understanding. There was an issue with the reagent in that initial test kit, and they had to go back and develop a correction for that before testing could begin. So that's my understanding of the issue as far as why we're behind in testing compared to other countries. Eleanor, it was my understanding that the CDC was holding back on widespread testing due to a risk of the original test showing false positives or negatives. My question is, from a public health perspective, which do you think is the lesser evil, choosing to test despite the risk of false information or choosing not to test? I mean, from a public, I mean, I am not myself a public health professional. I am a political scientist by training, so please take that into account as I answer this. But I do think that it could potentially make the situation worse if you're developing a body of false information and making decisions based on that false information. Because if you start to make resource allocations based on that information, or decisions about staffing and things like that, and then you find out later that the test was misleading you, and the problem is not really over here, it's over there, then potentially you added to the problem more than you solved it or helped to make it better. So in terms of your question, I would probably come down on, it would be best to wait until the accurate test is in place. And that's why I think a lot of people have argued that when they realized that testing was going to be delayed, social distancing could have been implemented earlier, perhaps in some particularly targeted places that were believed to already have a significant amount of COVID-19 activity, and then maybe if that had been enacted sooner, that would have bought more time before the test was ready to go. So thank you very much for your question. Part of preparedness might be the stockpiling of supplies and the expenditures of scarce public resources in what seems an inefficient manner. How would you suggest a way to measure the value of a policy that seems wasteful but really is part of preparedness? So the idea of stockpiling resources is a good example. I mean, we do have this thing called the Strategic National Stockpile, which is effectively warehouses distributed throughout the United States, which, if called upon in the event of a major disaster, can distribute resources around the country. It has been used in a number of situations, 9/11 and so forth. So people might look at that as wasteful because eventually those materials do expire, especially vaccines and antivirals. If you stockpile them, eventually they go out of date and you have to replace them with more recent ones. But I think we have to kind of look at the situation as it stands right now and kind of look at how those resources that we've stockpiled have been used in this emergency, what resources we haven't stockpiled that we need to stockpile in the future. Do we need to stockpile more ventilators? Do we need to stockpile more types of PPE than we have previously? And make kind of data-driven decisions based on that. We may learn that we need to stockpile, that maybe we need to stockpile some different things. But we've definitely found that either we need to up our production capacity in the United States and more regularly produce these types of goods. We need to have them stockpiled, or we need to have stronger supply lines between our nation and other nations in order to make sure that we can get these things when we need them. It's one of those things. People will make the argument that we're preparing for something that may never happen. Well, now COVID-19 has shown us that something that seemed extraordinarily unlikely can happen at the most unexpected time, and we can be caught completely unprepared for it. And people in hospitals and public health departments around the country are paying the price for that. And we also need to look at hospitals and the degree to which hospitals need to stockpile more resources and things as well. So, Javier, I'm responding back from my question. Thank you for your response. Not to go into detail, which would take a long time to explain or put together. The answer to what you explain is to form an agency. I hope our government will form a separate agency, Department of Emergency Response. I mean, there has been a suggestion, I think Ron Klain is an advocate of this, that they create an organization called FEMA, but that's FEMA with a PH as opposed to an F, so it'd be Public Health Emergency Management Agency. So there has been a suggestion that we create a standalone agency. I'm not necessarily suggesting that we create a standalone agency. I mean, the National Security Council involves, people from the Department of Defense, the CIA, intelligence agencies. So it's not so much a matter of creating a standalone agency as much as it is bringing together experts from the Defense Department, the intelligence agencies, the Department of Homeland Security, and all these different groups, and have them regularly meeting, regularly planning, regularly sharing information to look at things in the future. Although your idea of creating a separate agency, it certainly has support among a lot of individuals. Yasmin, there are aspects of growing tensions, misunderstandings, or communication of contradicting information between the federal government and some state officials. So the governors of New York and Illinois, how do you see this impacting the response to COVID-19? So there's been sort of a pattern during the Trump administration that maybe the Trump administration has not always responded to the needs of states whose governors or whose leaders do not support him as much as he would like. So, California in the past with, the wildfires, there was some tension about federal assistance could have been provided in a more timely manner. And, obviously that's a democratically controlled state. I'm not, I can't necessarily speak to the president's motivation and the degree to which he responds more quickly to some and less quickly to others. But certainly in a time of crisis, it's good to, even though a president and a governor may be of different parties and may have a history of opposing each other politically, that they can treat each other with respect, that they look upon each other with respect. And I think that's an issue that's kind of eroded within the federal government and between the federal government and the state governments. There's, it used to be, like with the Superstorm Sandy situation, Chris Christie was a big opponent of Barack Obama, but that didn't stop the federal government from providing assistance to New Jersey in that situation. And, the situation was they were both leaders, leader of a country, leader of a state. They both had responsibilities. and they both kind of focused on those responsibilities. And I think with some of the Twitter back and forth and some of the rhetoric that is going on today, it becomes so personal that it does create a difficulty in terms of coordination and assistance. Ashley, do you think that we should, and I should note that Yasmin Haiti and Ashley Hemrich both assisted me with research on my book, so they should both be congratulated on the publication of the book as well. But Ashley says, do you think we should change the emergency preparedness rule due to the current restrictions? Do you think we would need to do more preparedness training or even a different type of training? Due to the research I did, it was a lot of training due to natural disasters and the effects of such. Do you think we should change this for in the future to deal better with COVID-19? That's actually a really good question, and it's something that Dr. Saskia Popescu and I don't know if Saskia is still in the room or not. She was in earlier, I thought. But we wrote a commentary piece for a journal kind of addressing this issue and effectively saying that under the CMS emergency preparedness rule, there wasn't enough focus on infectious disease. And I've kind of seen this firsthand with interactions with, doing research on healthcare coalitions. When healthcare coalitions are doing hazard vulnerability assessments, a lot of times they focus on things like active shooter or ice storms or hurricanes or things like that. Infectious disease doesn't, or at least in the past, didn't make it into the mix. Now, in the aftermath of this, I suspect that the conversation will be different, and that there will be more of a focus in the preparedness rule, or at least in terms of the training and preparation to try to be better prepared to transport patients and triage patients and things like that. So, very good question. So, Danielle.
I'm Danielle Kellogg. I'm from Texas A&M University. We're seeing politicians sort of making guesses at the time frame for ending social distancing. We're talking about restarting this for the economy by Easter. What's sort of the line there in terms of managing the public's expectations, making sure that the true experts on this do have their voice heard, while also that ultimate decision still remaining with our political leaders at the federal and state levels? So if you could just comment on that. Thank you.
Thank you very much for the excellent question. And I mean, this has been a big issue the last couple of days since President Trump sort of said in an interview that he kind of has a goal of opening the United States, effectively ending major social distancing by Easter. And I think Dr. Fauci's quote, I don't know if it was a direct response to this, but I saw a quote from him saying, the virus sets the timetable. The politicians don't set the timetable, the virus does. So I do think that it's important to reinforce to the American public that there will be an end point, that there will be a time when social distancing ends, there will be a time where people can go back to restaurants again, that people can go back to school again and have regular classes. There will be a point where this has passed. I think setting sort of artificial deadlines is not helpful, because if that deadline is not met, then it can lower morale, and if it is met, and it turns out you've set the deadline too soon, then you can make the situation worse, because there's evidence from the 1918 influenza pandemic. There were some cities that ended their mitigation measures too soon and then had a resurgence. And I think the danger is if you say, okay, social distancing is done, everybody kind of start to go back to normal, and then there's a resurgence, then it's going to be that much harder to get people to do it again, because people are going to start to get back into their usual rhythms that they missed, their usual routine, and they're going to be very resistant about going back in. So I think artificial deadlines are bad. I think what politicians can do is not only reinforcing that idea that there is going to be a light at the end of this, but talking about what that light is going to look like. And having the stimulus bills and having that support in place is a good start in terms of keeping people going economically during the emergency, but also talking about what is it going to look like in terms of people going out and being able to shop and eat out and things again. How is the federal government going to participate in this? How are state governments, local governments? So some sort of, putting out some plans or some ideas for after the disaster has passed, giving people hope, but not attaching deadlines that may not be kept to that. So, and if somebody else had their hand raised and wanted to ask a question, please do that again. So this is in response to what you were explaining earlier about banning travel. I'm out of Virginia Beach, Norfolk area, where we have a lot of government personnel. I'm in support of travel restrictions that should be implemented to tourists in non-emergency situations. Those with medical problems and need to seek specialty care should not be restricted and should not have a note from their doctor to allow boarding. Senators, congressmen, and any U.S. government employees should be allowed to travel. The major problem we face for traveling is the proper equipment, decontamination, tunnels, gloves, etc. It all seems very extreme, but very necessary if we really want to take this threat seriously. For example, China has taken these extreme contingencies by arming robots to spray disinfectant through the airport in Beijing. I believe we're at the extreme level. I believe that we are at that extreme level, but I've not seen enough action equipping the major airports. We also might look into closing smaller and private airports. So I can definitely appreciate the frustration in terms of, particularly if you're somebody who needs to travel to get treatment or for vital business purposes or something like that. I think part of the concern would be making major changes to U.S. airports in the midst of a crisis that we may or may not need after the crisis has passed. So I think any decisions about major infrastructure changes to U.S. airports are probably better left until after we've weathered the immediate danger, we've kind of had a chance to look at the data, and we can decide, okay, how do we need to adjust airports and how they operate just the way that we adjusted airports after 9/11 to try to make things safer. So I don't know that I would necessarily be in favor of a lot of major infrastructure changes at airports right now. I think in general, restricting airline travel is a good idea. I think it would be good if there were special waivers for people who needed medical treatment or the government helping to facilitate their movement around the country would be good. I think members of Congress, if they do, for example, if members of the House have to return and vote on the stimulus, I imagine they'll probably be flying non-commercial travel, maybe with smaller groups of representatives traveling at the same time, something like that, to kind of mitigate the spread. So it's a difficult situation because in general, social distancing works and restricting airline travel is part of social distancing, but there are going to be people who are going to be harmed potentially by that practice. So making adjustments to that. as we go, recognizing that those needs are there and trying to meet those needs as they come. So, any other questions or comments? How do you feel about the psychological effects after the fact? I'll answer this, and then that'll be the last question, because I think we'll wrap up after that. So as far as the there's a lot of psychological effects going on right now, and I think there probably needs to be more consideration about maybe surging some mental health resources to people, either through the government or through private providers or nonprofit organizations, so that even if somebody's sitting alone in their house, they still can do tele mental health appointments with counselors and things like that. In the aftermath, there's going to be, I'm sure, a lot of sort of post-traumatic effects, people being squeamish about going out in public, people not wanting to get onto elevators with other people, not wanting to get into subway cars with other people. And I think, again, it's going to highlight that mental health care is something that we need to put more resources into in this country, and we need to acknowledge the fact that people need mental health care as much as they need physical health care. And maybe the experiences that people have during this emergency and after this emergency will help to make that point. So with that, I'll hand it back to Dr. Koblenz.
Okay, thank you very much, Dr. Myers. That was a great talk, and I think really provided a lot of important context to understand what we're seeing today with the kind of collision between partisanship and the pandemics. And unfortunately, this is not a new concern, as you provide several examples going back to Zika and H1N1, where public health has been politicized. Unfortunately, I think the stakes are the highest we've ever seen for public health emergency preparedness, and unfortunately, our political environment appears to be more toxic than it's been in quite a while. So again, greatly appreciate your insights into kind of the sources of the current situation, and at the same time, some of the silver lining you discussed in terms of the bipartisanship that we have seen emerge. For example, the stimulus bill passed, I think, 96-0, and probably the only unanimous Senate vote we've had for who knows how long. So there is some silver lining about bipartisanship here, but clearly the effects of the partisanship have been, unfortunately, the most kind of prominent and dominant ones. So again, thank you very much. Thank you everyone for logging in. And for those of you who are watching from home, thank you for downloading this, and look forward to another time when we can bring Dr. Myers out to George Mason and do this all in person. So thank you very much. Bye, everybody.
Thank you very much, Dr. Koblenz, and thanks again to the Schar School and to George Mason University. And I appreciate everyone tuning in tonight and participating, especially those people who asked questions and made comments. And I hope to continue the discussion on Twitter. For those of you who are active on Twitter, if you search the hashtag PHEP, it's pretty easy to find me on Twitter. So feel free to ask questions or make comments there. And thank you again very much.
Thank you.